some of you, when you guys are practicing, again, what are we grading you on? Not only your thinking process, your position, patient positioning. Don't have the patient up here with their head up here and their neck rotated. And you got a face down here. I'm going to mark off for that. That's not comfortable. Maybe comfortable for you, but it's usually not comfortable for a patient. All right? So patient comfort is important. So with grade 1, and here, side, getting them into a comfortable position. What is their most pain-free position? So you may have to play with it, maybe put them in a little more flexion, maybe put them in a little more extension. What feels the most comfortable? This is that P1, this pain dominant. I want to reduce their pain. I don't care about resistance. I want to get there, but I want to really decrease that. And so it's just that small amplitude, small movement. Okay, grade 2 is a larger amplitude, short of the resistance. So the difference is now I'm going to put her arm on her rib cage and going to increase the amplitude. So I want her to stay nice and relaxed. So with a grade 2, with a pain dominant, I may start out small and then try to increase that amplitude as much as I can. And then I want to get that opposite kind of shoulder rotation and just getting a nice movement. And seeing how's it going, what's happening, how are you feeling? It's a little too much. Okay, I might ease back up. And just do a short 30-second treatment bout. Don't want to overdo it. The mistake that we think is something worked, let me do more. Not necessarily. I would say if you have a good response, stop. Don't do more. Sometimes more is not necessarily better. Okay? Now with grades 3s and 4s, so now this is where I go to set them up. So let me have you slide towards me. Actually, let me have you rotate on the other side so I can see your back. You guys can come up if you like. If you can't see, I'm not afraid. Slide towards me. There we go. So you want to put them just in a general neutral rotation. Let me have you straighten your bottom leg out. So I'll just facilitate that. Drop their foot either behind their calf or behind their knee. Not palpating a specific level, just have my hand on their lumbar spine. Go ahead and reach for my shoulder blade. There you go. So just relax. Go ahead and drop your head. And now I'm just going to rotate her just to the point where I start feeling something coming into my hand here in rotation. So I'm going to keep her there, keep her arm here. She's nice and balanced there. And now I'm going to come, and I'm going to kind of feel what I'm working with here a little bit. So just keep your arm there for me. I'm just going to hold here. I'm grade 3. So now I'm going to feel kind of where I start feeling a little bit of resistance. Start feeling that R1. And now I'm going to take her to R2. And now I'm going to go large amplitude, kind of 50% of the range. So grade 3. Grade 4. Take her to her end range, and small amplitude at the limit. Okay? Or, if I want to get even more aggressive with a grade 4, I can bring her leg down and do a grade 4. What you want to be careful with that is that you are potentially stretching the sciatic nerve, and if they have neuro symptoms or positive tension sign, you're going to provoke symptoms with that. So if that's your intent, great. If not, then maybe not do that.